Dr. Trehan, many congratulations on the amount of work you're doing on the ground, and you even cured a whole lot of Italians who were in your hospital, and I think there were 14 of them and they went away. What role can private hospitals play in this over the next 2, 3, 4 months? 60 to 70% of hospital beds in India are for the private sector. What should they be incorporated? How should they be involved in this whole fight?
So Pranay, we have actually sort of recommended, and the governments are also thinking on the same lines, that the way to fight this deadly problem is to create COVID hospitals. So these COVID hospitals will be isolated from the regular stream. So there are two ways of doing it. One is to take a facility and just convert it into COVID, and like the government has done to some of its facilities. Or if there are private hospitals which can isolate areas where they can treat COVID patients without affecting the rest of the hospital, that's what needs to be done. So the planning is quite extensive on the ground. Like if you took the Delhi state, they've already put aside enough beds to be able to take care of up to 30,000 patients at the same time if they appear only in government facilities. Then of course there are private providers also who have volunteered parts of their hospital which they could isolate from the rest of the hospital to be able to take care of them. Especially the need will come for private sector when it comes to critical care, because the number of intensive care beds in the private sector, fully equipped and with the sophisticated ventilators which you may need in the case of severe cases, those are present in the private space. So there has been a good dialogue between the government and the private sector, and they are all working together. We have made the plan as it ramps up. The plan has been made in those as sort of graduated manner, that what happens when. So I'll give you an example of Gurugram, that we are now, all the hospitals, major hospitals in Gurugram have adopted a 500-bed hospital, which we are gearing up to make the COVID hospital. If there is an overflow from there, then that needs to go to the private hospitals. If they are very serious patients, we can always help out.
That's good to hear.
So I think there is no difference in our approach. The approach is coordinated well. The only thing is that how severe, if it is ever going to happen, how severe will it be? Like, could it be like what's happened in New York City, where 15,000 beds are not enough, and they've had to bring in a ship to supplement, so many things have happened around the world which shake you. But if you look at the data in India today, and there is on one hand, a very good feeling that maybe the increase is very slow, but on the other hand, there is discomfiture that there is maybe, we don't know yet, the surge is still to come. And I think whatever it may be, the fact that we have got some time, especially because of the lockdown, that we have got some time to do some intense planning, and also it's helped us to try to acquire the protective equipment that is essential for healthcare providers at this stage, the frontline workers, because Italy's experience showed us that they were ill prepared and a lot of doctors got sick.
Right.
Today, I'm glad to say that the Indian industry, Indian garment manufacturers have actually risen to the occasion, the textile industry. They've been able to make these protective gears. I think by the time we need them, I think we would have been able to produce enough of them in India itself, which is a good thing, because depending on China is not a very nice thing to begin with, but then we don't know the quality of stuff coming from China right now. So I think the PPEs will be okay.
Well,
we're trying to gear up for the ventilators, and the Indian industry has also come up with that.
If I can just interrupt you there, Dr. Trehan.
On the private side, and the government working together has been very effective.
Well, if I can just interrupt you, you're quite right about China. It's not quality really. The quality is often fine. What's happening is America is outbidding the rest of the world and buying everything from China. We've had 2 reports in the last 2 days. A flight going to a province in Germany from China with full of, I think there were masks and other medical protective gear, had to stop in Bangkok for a refueling. America phoned the suppliers and said, we will pay you 3 times what the Germans are paying you, and the flight was diverted to America. They've done that again and again, and for a poor country like India, we can't afford to pay 3 times what others are paying. It should not get into a bidding war. So the WHO, we spoke to Soumya Swaminathan, who said this is a big issue and we must work with cooperation globally and equity. Rich countries shouldn't get all the best and the poor countries get nothing. So you're quite right, don't depend only on China, but are you saying that, as usual, there's that saying, hope for the best but prepare for the worst?
That's it. That's the message. And also the message that I've been giving all along, and I've believed in it, is the fact that masks should be worn. Anytime you're going out, wear a mask. Every country now is saying that, the WHO is saying that, and I don't know why. The fear was that maybe if everybody started wearing a mask, there will not be enough left for the surgical mask for the frontline workers. But we also know that cloth masks, 3-layered cloth masks, which are now available in abundance, are equally effective if you are not a frontline worker, if you are not infected. So basically the N-95, which has been misunderstood, it is not for general public. It is for actually the frontline workers who are taking care of the COVID infected patients. So there should be no sucking out of vital supplies like N95 masks by the general public, even if they can afford it, because it is not needed, it does not give you that protection.
Well said.
All you need is 2 things.
A
One
piece of cloth.
is the fact that if somebody coughs and sneezes who is infected with the virus, then we know that the bigger droplets that are sneezed out or coughed out do carry a viral load which can be infective. Now there is another confusion that's happened is that, you know, there has been a video shown by the Japanese that they say that the micro droplets spread all over the room. Now the question is, do those micro droplets carry enough virus to be able to infect somebody? So far there is no evidence of that. So that's why we believe that there is no fear of that, and especially you should keep your rooms aired, because if there's air circulation, in any case those things get wiped out. So wear a mask if you're going out, especially if you have a cough and cold, stay away from people and wear a mask. So I think if we take this social distancing, which everybody around the world has experienced, is the only effective tool against this virus, because there is no medication yet. There are some medications coming down the pike. There is promise of remdesivir, which is being tested in America right now, manufactured by Gilead. It has hope in the last stage of the disease, not as a prevention. Vaccine is popularly believed that it will be 6 to 12 months before we can see a vaccine. Right. So in the meantime, social distancing, masks and hand hygiene. These are the 3 things you can do to help yourself.
डॉक्टर त्रेहान, आपका बहुत बहुत धन्यवाद। मेरे ख्याल से एक कोई इमरजेंसी कॉल आपकी आ रही थी, हम लोग क्षमा चाहते हैं कि हमने आपका थोड़ा सा समय ले लिया, but thank you so much for joining us on this broadcast.
I hope everything is all right with that emergency call, and
welcome.
thank you for being with us.